Welcome to this video on the Mpox virus infection, which has gained global attention due to recent outbreaks. In this session, we'll delve into the clinical presentation, transmission pathways, and diagnosis of Mpox infection. We will also review the treatment protocol recommended by WHO and the Center for Disease Control. Signs and symptoms of Mpox infection can appear within a week after exposure, though onset can range from 1 to 21 days. The symptoms usually persist for 2 to 4 weeks but may last longer in individuals with compromised immune systems. The most common symptom are rashes that starts as a flat sore and progresses into fluid-filled blisters that can be itchy or painful. As healing occurs, these lesions dry out, form scabs, and eventually fall off. The number of skin lesions may vary from 1 to hundreds or more. These can manifest on various parts of the body such as the hands, soles of feet, face, mouth, throat, groin, genital areas, and anus. Other symptoms include fever, sore throat, headache, muscle aches, back pain, fatigue, and swollen lymph nodes. Some individuals may also experience painful rectal swelling or discomfort when urinating. Lymphadenopathy is a distinctive characteristic of Mpox infection. The Mpox virus is primarily transmitted through close contact with an infected person, animal, or contaminated materials. Key routes of transmission include direct contact with the rash, lesions, or bodily fluids of an infected individual, respiratory droplets, touching of contaminated surfaces, contact with infected animals, particularly through bites, scratches, or consuming undercooked meat from infected animals. What measures should the health ministry of every country take to stop the spread of Mpox? Comment below. Complications of severe Mpox infection include sepsis, skin damage, pneumonia, dehydration, corneal infections that may result in vision loss, encephalitis, proctitis, balanitis, urethritis, and death. Those with weakened immune systems, whether due to medications or underlying medical conditions, are at a heightened risk of severe illness and fatal outcomes from Mpox. People living with untreated or poorly managed HIV are particularly prone to developing more severe forms of the disease. The preferred investigation for diagnosing Mpox is the detection of viral DNA using a polymerase chain reaction. Samples can be taken from the rash, including skin, fluid, or crusts, by performing vigorous swabbing. If skin lesions are not present, swabs can be taken from the lesions of oropharyngeal, anal, or rectal areas. Blood testing is not recommended. Antibody detection methods have limited usefulness, as they cannot differentiate between various orthopoxviruses. Currently, no specific treatments are approved for Mpox virus infections. Most patients with intact immune systems recover with supportive care and pain management. Acetaminophen and NSAIDs are commonly recommended for managing general pain. For localized pain relief, topical steroids and anesthetics, such as lidocaine, may be used, but caution is advised when applying them to broken or draining skin. In certain situations, prescription pain medications like gabapentin and opioids might be considered for short-term relief of severe pain that doesn't respond to acetaminophen, NSAIDs, or topical treatments. However, the use of opioids should be carefully balanced against potential side effects, including constipation, opioid use disorder, or overdose. Opioids should be prescribed only when necessary, using immediate release forms at the lowest effective dose for the shortest time. Oral antihistamines might help with itching caused by Mpox lesions. Topical agents such as calamine lotion, petroleum jelly, or colloidal oatmeal can also provide symptom relief. Available therapeutics. Tecovirimat, an antiviral originally stockpiled for smallpox, was made available during the 2022 Pox outbreak under the CDC's Expanded Access Investigational New Drug Protocol. Its use for Pox infections remains investigational. While initial studies show tecovirimat is well tolerated, its effectiveness in reducing lesion duration is still unclear. Ongoing clinical trials are evaluating its safety and efficacy for Mpox. Brincidofovir is another antiviral approved for smallpox that can be used to treat Mpox in severely immunocompromised patients or those at high risk of severe illness under an emergency use protocol. It is often combined with tecovirimat. Although not specifically approved for Mpox, vaccinia immune globulin intravenous may be used in severe cases where the immune system is compromised. It is generally administered along with other treatments like tecovirimat. Cidofovir was originally used to treat cytomegalovirus retinitis in AIDS patients. This antiviral has shown effectiveness against orthopoxviruses and is considered for severe Mpox cases, often in combination with tecovirimat. Vaccinations. Currently, the WHO recommends the use of 3 vaccines for Mpox. The MVABN vaccine, LC16 vaccine, and the ACAM2000 vaccine if others are unavailable. Vaccination is advised only for those at risk, such as close contacts of someone with Mpox or individuals in high-risk groups. Mass vaccination is not recommended at this time. Travelers at risk should consider vaccination after discussing their risk with a healthcare provider. The MVABN vaccine is approved for use in individuals over 18 years of age, with 2 doses of 0.5 ml administered subcutaneously, 4 weeks apart. In 2022, however, the US FDA authorized an intradermal administration for high-risk individuals aged 18 and older. This method requires only 1/5 of the dose to increase vaccination coverage. For individuals under 18 years of age, the recommended route remains subcutaneous. The ACAM2000 vaccine is given as a single dose using a bifurcated needle and the scarification technique. Similarly, the LC16 vaccine, an attenuated, partially replicating Lister strain of vaccinia, is administered in a single dose using the scarification method with a bifurcated needle. Do you think the Pox infection will spread throughout the world like the COVID pandemic? Comment below. Thank you for watching. Don't forget to subscribe for more interesting medical topics.